I'm curious. I am curious. Curious.
By nature.
Welcome to Curious by Nature. I'm Jessica Johnson from Newswise. Patients with resistant depression sometimes spend years trying numerous psychiatric medications with little or no effect on their symptoms. Alternative therapies are being investigated to treat these cases with options like neurostimulation using magnetic fields. With the latest advances in this therapy, doctors are using MRI to target specific areas and effectively rewire parts of the brain causing depression. We're joined today by a psychiatrist at UAMS Health in Arkansas, where she is seeing the results of these new techniques finally giving patients relief. Dr. Grooms, welcome. Please introduce yourself.
So my name is Dr. Amy Grooms, and I'm a psychiatrist at University of Arkansas for Medical Sciences here in Little Rock, Arkansas.
Can you finish this sentence? I'm curious about.
I am curious about the brain and how it is able to manifest all the wonderful variety that we see in humanity on a personal level and a cultural level.
And can you tell me about the work that you do?
So I like to say all the time that I have the best job in the world. I am a psychiatrist, and my practice is primarily with helping patients who are struggling with treatment-resistant depression and talking to folks and helping them get better through treatment strategies like transcranial magnetic stimulation, ECT, and some of the more kind of recent developments in the field of psychiatry.
And what would you say is the percentage of depressed patients that have not been able to find solutions for their depression and they come to see you?
So, there was a study called the STAR-D study back in 2008, and they looked at if you kind of take patients through standard sort of protocol of medication trials and looking at the percentage of patients who most people are able to have benefit from kind of your first line treatment. And then going on, there tends to be cohorts of patients who don't respond. In the trial, there were 4 levels, and each level kind of caught the patients who were not responding or in remission to that pharmacological treatment stage. And by the end of it, there was still 30 patients who had not, 30% of their cohort who had not responded to any medications, any treatment. And they also included, therapy as part of their study protocol. So there's, a general rule of thumb is that, there's usually around a third of patients in studies who continue to have treatment-resistant depression.
From what I know, you are implementing and doing the SAINT therapy for depression. And from what I've read, that can have like around an 80% effective rate of treating depression and these untreatable depressions. Is that correct?
Yeah.
Can you tell me what SAINT therapy is and how it works?
What SAINT therapy is a kind of neuromodulation treatment, and it uses a TMS machine. It differs from standard TMS in that rather than having, standard TMS treatment course lasts 4 to 6 weeks. And you're coming to the office, you're sitting in you're getting that treatment for 20 to 40 minutes a day for 5 days a week for 4 to 6 weeks. What SAINT does is it smushes all of those treatments into 5 days. And the reason we're able to do that with the same efficacy as standard TMS is because the way we've been able to deliver the stimulus pulses, so the the pattern of the stimulus and make that more congruent with kind of the same pattern that we hear in our own neurons. So make it more consistent with how the brain actually works.
How do you make it more consistent? And also, I think I've seen something about having a brain scan before, or
Yeah, so that's the other really exciting piece that I think the SAINT protocol brings to the table is that we know that everybody's depression is different. We know that everybody's anatomy is different. And by using functional fMRI data, so each patient gets a functional fMRI, and then that data is processed through a machine learning algorithm that specifies for each person where the optimal target for stimulation is. In practice, once we have this nice target, then how do we make sure that we're targeting the placing the coil accurately? And so one of the neat things that this system does is that you have the patient sitting in the TMS chair, and then we use essentially motion capture kind of technology to ensure that we're placement of the that we are precisely targeting each person's optimal target. So it's a really personalized and precise way of delivering the stimulation. So those are kind of the three of the main kind of ways that we've been able to improve upon the standard TMS protocol that was FDA approved in 2008. The SAINT protocol, as I've described it now, was FDA approved in 2023 for patients with treatment-resistant depression.
so there is a coil that is placed on someone's head, basically, and that's the same for both SAINT and TMS protocols.
Yes. So what the coil is, so what TMS is, it stands for transcranial magnetic stimulation. And what it does is when I say coil, I mean magnetic coil. So we have a very strong magnet that's placed on the person's head, kind of right up in the front, and an electric pulse goes through the magnet, which then stimulates a small, tiny electric charge in the cortex. So we use so that's how we're able to kind of deliver this very small and localized electrical impulse using a magnet.
And so, if I understand correctly, the difference between SAINT and TMS, and maybe I'm saying this very simply, is that you're able to specify the location where the TMS or the magnetic or the coils will be placed in order to access that precise, personalized location for that individual's brain.
Exactly, right.
Are there any side effects or negative effects from having this treatment?
What we've experienced with our patients here and also looking in the studies, the main side effects are headache on the day of treatment and some discomfort on your scalp where the stimulus is targeted. TMS and SAINT in general are pretty benign, all things considered.
With treatment-resistant depression cases that have success with TMS and SAINT, how do the patients react to finally finding a therapy that works?
You know, a lot of times when I see patients getting better from depression, it's the little things. So someone will come in and tell me, you know what, I actually wanted to get out of bed today. Actually, you know, doing the basic kind of household things was not a chore. I started to enjoy and started to think, maybe today I will go out and engage in some of my hobbies that I've set aside. And for most patients, when they start to notice that, there's this element of excited surprise, like, oh my goodness, I thought this was out of reach, thought this couldn't happen. And so it's pretty tremendous to start to see people kind of go through this experience and start to feel like themselves for the first time in a long time.
Yes, that must be very fulfilling to see. UAMS was the first clinical setting to offer the SAINTS protocol. Is that correct?
Yes.
What are the next steps of this therapy?
I think the next steps of this therapy is to really do more research looking at how durable is the effect. And are there ways that we can, well, before going on to other things, but what I mean by how durable is the effect? So if somebody has a response, how long does that response last? We know that with standard TMS, we can generally expect folks to have a response continue for around 3 to 6 months. And so I think getting that information for Saint TMS will be really critical in our next step. I think the other avenue of further research that I personally find exciting with Saint TMS is that one of the developments with this is to, provide this really highly precise and individualized target for treating depression. And I'm curious about, should we be looking at other targets for things like, say, depression related to bipolar disorder, or perhaps OCD. So can we start to use these same kind of refinements for using TMS for other conditions outside of just major depressive disorder?
Have you seen that there's research or are people studying maybe how this can be used or something similar for schizophrenia?
There has been some research looking at, can you use standard TMS to help patients with chronic hallucinations? So using a different target kind of help decrease the activity in the brain that's correlated with experiencing auditory hallucinations. And there's been some, work towards that. But I think we need further research to really refine that neurocircuitry pattern and to really find, I think, an optimal target.
Does insurance cover this treatment?
Only traditional Medicare covers this treatment. But if you look at kind of the trend generally, that when Medicare starts covering something, the other insurances follow. And there's some concerted efforts right now to make the case that, this treatment is actually potentially more cost effective for folks than some of the other kind of less effective or less rapid treatments out there for treatment resistant depression.
And if someone doesn't have insurance coverage or Medicare wants to travel from abroad, do you know what the approximate cost would be for them to get this treatment?
The approximate cost differs across the different locations and can range between $25,000 to $45,000 out of pocket. And that would cover the fMRI, the treatment itself. At least in our institution, we approach it as a bundled. When you start to look at what is the cost of treatment resistant depression and how does that impact someone's ability to work, how does that impact, how much are we spending on other treatments that are taking longer and perhaps not working as well? I think we have to kind of think about the cost in those terms.
Because of people with depression, they might be not in the position to learn about this treatment. They might not be able to make it all happen. It seems like sometimes that can be a side effect of depression, that people aren't able to help themselves sometimes. How do you recommend either friends or family or those individual patients helping to make this happen and helping to get someone there?
I think the first step for a lot of patients is to make sure that you're seeing a psychiatrist, and if that's available in your community. As far as specifically kind of getting more information and perhaps a referral to our program, we have it kind of all lined out on our website through UAMS. The website is psychiatry.uams.edu/clinical-care/interventional-psychiatry. And we also have an email that folks can reach us through, psychiatry-interventional@uams.edu.
Thank you. I appreciate you taking the time and talking with me.
Curious by Nature is a production of Newswise. More than 7,000 journalists get the Newswise wires. Visit newswise.com and find out how to spread your news today.